The topic for our case study is early childhood education. I'm Hannah Del Rosario.
I'm Olivia Delaplane.
I'm Shira Blaine.
And I'm Lynn Alcalou.
Early childhood education includes all education programs from birth to age 8. This includes public schools, private schools, preschool, and daycare. It is where children learn the fundamentals of literacy, number skills, social interaction, and problem-solving skills. However, for the purpose of this case study, we will primarily be focusing on preschool and the alternatives to preschool, specifically Head Start. Early childhood education is important because early childhood is one of the most sensitive stages in life. It is when a significant amount of brain development occurs and when children develop and mold into their learning types. The environment that a child spends time in during their early childhood has profound impacts later in life, and education plays a large role in that environment. The significant impacts of the environment include achievement in school and their career. The problems associated with early childhood education include unequal enrollment of children in programs due to economic disparities, less accessibility of programs for low and moderate income families. The solution we propose for these problems is high-quality early childhood education that is accessible to all. This would include universal preschool, which should be available to every child between ages 3 to 5. Current examples of these programs include Head Start, Oklahoma's 4-year-old program, and Boston's public schools pre-K program. The solution is beneficial because there are significant learning gains across all demographics, especially in minority and low-income students. It is also effective in narrowing the achievement gap.
In 1965, a program named Head Start began, which provided children and families below the poverty line with an experience similar to preschool. This has made positive differences in children's social and cognitive development, as well as immunization rates and dental health. From a longitudinal study that started in 2002, it was found that children who joined Head Start when they were 4 were faring better than their peers on 5 of 15 factors of school readiness after a year of the program. Those who joined the program when they were 3 were doing better on 11 of 15 indicators. Immunization rates have been impacted because enrollment in Head Start requires immunization records, with the only exceptions being medical or religious exemptions. The Center for Disease Control and Prevention, CDC, provides grants to support 64 vaccination programs, which include Head Start facilities. In a biennial survey, 33 out of 64 areas submitted coverage levels for children who were enrolled in the Head Start program. In addition, the Head Start website provides information from the CDC for the parents and guardians, which includes recommended immunization schedules based on age. The staff of the Head Start program also promotes and teaches about oral health to not only the students but also their families. In 1962, the high-scope Perry Preschool Project began, which was a longitudinal study involving 123 high-risk African American children. This study displayed that high-quality preschool education could yield lower rates in juvenile delinquency, higher grade point averages, higher graduation rates, and more.
In terms of the current situation, early childhood education in the U.S. has been described as fragmented, mediocre, and uneven. This has been attributed to the disconnect between preschool and primary school, as well as the disparity in accessibility to such programs because of various factors. Statistics provided by the Department of Education tell us that as of 2013, 59% of 4-year-olds are not enrolled in publicly funded preschool programs, and as of 2010, 6 states do not require kindergarten in school districts, with these states being Alaska, Idaho, New Jersey, New York, North Dakota, and Pennsylvania. Moreover, 1/3 of children attending kindergarten only attend half-day programs. Access to these early childhood education programs varies among different populations. The Economic Policy Institute asserts that access is influenced by income, parent education level, language speaking abilities, and location of residence. Parents with higher income and education level are more likely to enroll their children in center-based pre-K programs, while parents with children living in more rural areas are less likely to enroll their children in early education programs than families in urban areas. Moreover, Black and Hispanic ELL children begin kindergarten with the greatest disadvantages in math and reading, due largely to links between minority status and social class. Overall spending on publicly funded early education programs has increased over the last decade, while spending per student has decreased. However, on a more positive note, states have improved quality of pre-K programs over the past decade. Most states are now meeting the 10 benchmark standards of pre-K programs, with these standards including providing more than one meal for students, requiring teachers to have a bachelor's degree, and having a class size under 21 students. 100% of pre-K programs now cover multiple facets of early childhood education, including cognitive learning, social development skills, physical well-being, and more. Successful universal preschool programs include those in Michigan, West Virginia, North Carolina, and Washington, with a notable program of North Carolina, where the pre-K program there serves 27,000 4-year-olds from low-income families, where the lead teachers must be highly qualified, and the pre-K program there is seen to narrow the achievement gap by 30% at the third grade level.
There are many strengths to instituting a universal pre-K program like the program we just described in North Carolina. It would narrow the achievement gaps in kindergarten between white and minority students, as well as between middle and upper class students and low-income students. Narrowing early childhood achievement gaps has been shown to lead toward increased graduation rates, college attendance, and increased wages over longitudinal studies. It would also improve physical health as well as the cognitive and social development of a wider range of children. However, there are some weaknesses with a proposal to institute a universal pre-kindergarten program. For example, it would require significant monetary investment as well as political will from federal, state, and local governments. Head Start and other pre-kindergarten programs are already underfunded, so a push to make them more accessible to more students could spread the money available even thinner. However, there are some opportunities that could arise regarding universal in early childhood education programs. Changing leadership in the Department of Health and Human Services, which is the agency that funds Head Start, could provide an opportunity for strong supporters of Head Start to have more sway and influence. There's also the possibility of restructuring Head Start as a block grant program to the states, which would encourage state investment in providing universal pre-kindergarten. There is also increased public discussion and understanding of achievement gaps in education, which could lead advocates of universal early childhood education to gain more public support for the initiative. However, there are some threats to implementing these programs. The changing leadership in the Department of Health and Human Services could instead lead to instability and inefficiency, making it so nothing got done. It's also unclear what the priorities of the Department of Education are regarding early childhood education. In general, there seems to be political resistance to increase spending on social programs in general, which would hurt any proposal to increase funding for Head Start. As a solution, we advocate providing universal pre-kindergarten in the U.S. In the short term, we would recommend starting at the state and local level. At its current state, early childhood education programs don't have the funding or resources they need to serve their students equally across state lines. So one solution could be to narrow the eligible populations. For example, in the State of Head Start reports, researchers recommend narrowing the eligible population to children who are homeless or at high risk of abuse or neglect. We also would recommend modeling local programs off of successful states and cities such as North Carolina and Boston Public Schools. In the long term, though, we recommend significantly increasing federal funding for Head Start and also to use economic incentives to increase private investment in early childhood education. A wide range of philanthropic foundations such as the Bill and Melinda Gates Foundation, the W.K. Kellogg Foundation, and the Walmart Foundation have identified early childhood education as one of their main causes to invest in to supplement the funding that these programs are able to receive in the face of government budget cuts.
Research and evidence has made clear that students across the country are unable to receive high-quality early childhood education due to prohibitive costs and lack of availability in certain areas. Minority and low-income students are disproportionately affected by the lack of quality early education and therefore enter kindergarten less ready to learn than their white or more affluent peers. This gap only widens as students continue their education. Narrowing this achievement gap requires increased investment from all sectors in early childhood programs, starting at the federal level with Head Start, but also at the state and local levels. Additionally, contributions from private foundations would ensure that children have enough resources to learn and qualified teachers are paid enough to stay. If early childhood education could be adequately funded and expanded to reach all young children in our nation, we would be able to improve economic, social, and health outcomes for years to come. Thank you for listening.